Adrenal fatigue is a diagnosis used mostly in alternative medicine, usually amongst naturopathic physicians. The diagnosis is based entirely on the finding of low levels of cortisol on saliva test done in the morning. The primary concern is that treatment of this condition often involves the prescribing of cortisone. Naturopathic physician James Wilson, in his book called Adrenal Fatigue, the 21st Century Stress Syndrome, was published in 2001. He gives a list of symptoms suggestive of adrenal fatigue, and these include fatigue unrelieved by sleep, difficulty falling asleep and staying asleep, decreased ability to handle stress, depression, increased PMS in women, increased symptoms when meals are skipped, problems with focusing with memory lapses, decreased tolerance, especially when irritated, low energy between 3 and 4 p.m., difficulty staying on task, being easily startled, which causes palpitations, anxiety attacks, hypoglycemia, and weight gain. Excess adrenaline can actually cause every one of these symptoms. So is adrenal fatigue a condition related to too little cortisol, or is it related to too much adrenaline? A condition that I refer to as adrenaline dominance. The distinction is important because the treatment for the two conditions differ. Symptoms related to excess adrenaline can often be largely relieved within 24 hours. Problems related to adrenal fatigue, which should more aptly be called adrenal insufficiency, are more complex and may take months to correct. The source of confusion between adrenaline dominance and adrenal fatigue arises because of the tendency of many doctors to use saliva test. What is not taken into consideration is that adrenaline is a survival hormone. It's the fight or flight hormone. Part of this response involves the action of adrenaline to cut off circulation to areas of the body not needed for survival. The salivary glands are not needed to function in times of danger. Other examples of adrenaline's ability to cut off circulation includes the following. The most common cause of cold hands and cold feet is actually excess adrenaline, not a low thyroid. Constriction of blood vessels in the eye can cause glaucoma, which is often treated with beta blocker eye drops, which actually block adrenaline. Similarly, vasoconstriction of intestinal blood vessels leads to IBS, which is another symptom ascribed to adrenal fatigue. In actuality, as opposed to a saliva test, blood tests will demonstrate a higher than expected level of cortisol in the morning. Actually, any level above 12 should be considered high. Prescribing cortisone for a condition possibly already associated with high levels of cortisol may have unintended consequences. Cortisone, if given inappropriately, can produce unwanted weight gain by raising sugar and insulin levels. It can also cause osteoporosis, cataracts, stomach ulcers, muscle wasting, and brain damage. For these reasons, it might make more sense to treat patients initially as if they have adrenaline dominance using a meal plan to provide the fuel the brain needs, along with a 5% progesterone cream. This protocol is presented in my book called Adrenaline Dominance. If the patient's symptoms are caused by adrenaline dominance, the symptoms should disappear or at least improve dramatically within 24 hours. If the symptoms do not improve within 24 hours, then the possibility of adrenal fatigue can be considered. Cortef, the drug most commonly used to treat adrenal fatigue, raises the cortisol levels. Patients can actually feel better when they start on Cortef because Cortef also raises blood sugar levels, which can decrease the body's need to put out adrenaline. It can also act as an antidepressant. Thus, Cortef can appear to be helping, whereas it may actually be making things worse. A word of caution: if a morning cortisol test, blood test, shows that the patient's cortisol level is below normal, and if the person's DHEA-S, which is dehydroepiandrosterone sulfate, and this is a hormone also produced by the adrenal gland. If this level is extremely low, the patient should probably be referred to an endocrinologist for the treatment of possible Addison's disease, which is known as adrenal insufficiency, a true condition of adrenal fatigue.